everyone, it's Craig here with Get a Position as it relates to your health. Today, I just want to bring to you just a few tidbits I've learned during my 23-year journey dealing with chronic kidney disease and being on dialysis. Currently now, I am a recent kidney transplant recipient. Praise God to that. And I just wanted to bring some awareness and just help some folks out on some things that I learned. And it has to deal with being curious. Curiosity doesn't always kill the cat. So the saying or phrase may go. As it relates to your health, curiosity is key. When I was training as a television director in live television, one of my mentors told me this. He said, Craig, it's not about the answer, but it's all about the question. And no question is a dumb question. During my kidney journey, many of my doctors were amazed at how curious I was to learn more about my disease, what I was dealing with, the amount of questions I was asking. One of the things was I can remember very vividly, I was going for a particular scan when I was getting ready to go. Well, I was on dialysis and they had to put my access in. And they had to do an ultrasound and of my veins. And the technician was just there. We were quiet. He was just asking me, are you comfortable? Are you okay? And I was like, okay, yeah, I'm okay. I'm good. But I became very, very curious about his job and what he was doing. And I said, can I ask you a few questions? And he said, sure. And I was just asking him questions about the machine, what he was looking at, the sounds it was making, why he was taking this picture, taking that picture. And I said, I'm sorry, man, I hope I'm not disturbing you in regards to you doing your job. And he was like, no, ask all the questions. He said, you know what? There's so many people come in here that look like us who don't ask questions. He said, man, I welcome it. He said, I'm here all day. He really by myself. So I welcome it. So I kept asking him questions. And then after I was done, he just couldn't stop talking. So my point is just be curious about your health, what the nurses are doing, what the doctor is prescribing. I have a few things I want to share with you. I have a little presentation I just want to share with you guys. Just give me a minute. I'll pull it up and we'll go through some things that I've learned. So I put in practice and I use them to today. And I hope this is helpful to you, not only those who are dealing with chronic kidney disease or on dialysis, but this is for anyone, even when you're going for your regular checkups and so on and so forth, or if you have to change doctors, or if you had a referral to go to a specialist. Here's some tools I picked up while I was going through. So let me share some things with you. Let me just get this up. We just got to be curious and ask questions. Here are some patient tools to put in practice. The keys to any conversation is oftentimes we are just listening to the doctors or other healthcare professionals and what they are saying. We're just listening to what they're saying. However, we have to train ourselves to listen to what they did not say. Let's look at the next slide. That'll explain some things in the next slide. Listen for the following. The what. Always listen for the what. Listen for the why. Listen for the how. Listen for the cause. And listen for the effects. Now, back to my earlier statement when I talked about listen to what they did not say. So if you did not hear your doctor or healthcare professional answer or mention any one of these above questions, because these are all questions, right? Now you have a few of your own to ask. So if you didn't hear the what, if you didn't hear why, if they didn't explain how it happened, okay, I didn't hear that during my appointment, so I'm going to ask that question. Okay, so that's why I said listen to what they did not say. All right, because we're listening to what they're saying, but what didn't they say? All right, next slide. Get to know your doctor. Some of us have been seeing the same doctors, the same PCP for years. We're pretty much comfortable with them, but oftentimes we have to go to specialists and different doctors. They want to send us over here, send us over there. And sometimes we have to go to do tests. And there are technicians that's performing these tests. So every healthcare provider has a practice of asking us, the patient, about our medical and family history. You know those forms you fill out when you go to the doctor's office, or you're a new patient somewhere. They always want to know about us or our family history. This is so they can make the proper assessments of your condition or diagnosis and the treatment plan. But how often do we as patients know the provider's professional history? Here are a few questions to ask, or just to, start a conversation, just to have both of us loosen up, because those healthcare professionals they're doing it all day, every day. It's a job for them, and so on and so forth. So loosen them up, right? So you can ask, how long have you been in healthcare professional? How long you been in the business? Why did you become a nurse or a doctor? That's a valid question because you're interested, right? You're curious. You're curious. The other thing, in the case of being a kidney patient, we often have to see a nephrologist. Usually we've already seen a nephrologist. Once we find out we've been diagnosed with CKD, we learn which stage we're in. One of the things I was curious about, because nephrology, that's a specific area. So you have your primary care physician, and then you have a specific area of concentration on the kidneys, nephrology. So you can ask, what was your interest in specializing in nephrology? Now you started a conversation between you and your healthcare provider, or I like to call them your partner now, right? So you just want to know, what was it about it? Was it because they make a lot of money, or they can do well, career-wise? What is it? I don't know how honest they would be regarding that portion, but you just want to know. You just want to know. Maybe they had a family member or was raised in a household where maybe their grandparent or their uncle or whatever it was, kidney issues, and so it sparked their interest. So that's how you know that particular provider or nephrologist or cardiologist or whoever it may be, they are really, really into what they're doing. They want to know answers. They want to do the research. So now you know who and what type of person you're dealing with. So they're really trying to get to the bottom of it, right? Right. Okay. Let's see. What else do we have here? This is get to know your doctor. Continue. Now, I had mentioned something about a partner or partnership. Keep in mind the relationship between you and your doctor is in the best interest of the business of you. It's your business to get healthy, right? And it's all about you, right? It's a partnership. That's what it is. It's a partnership. Most businesses have partners, and getting to know your partner is vital to the success of your health. I'm telling you, it's vital to the success of your health. And mentally, we have to get, as a patient, it's always, well, that's the doctor knows best. I'm just the patient, so I'm just going to take and do whatever they say to do. And I get all of that. None of us who are patients went to medical school. I know I didn't go to medical school. I felt like I did going through this whole kidney thing, right? However, we have to change our mentality as a patient to have success, a successful, healthy life. I should say it that way. So I have to partner. This is a partnership. And sometimes on the other end from the healthcare providers, and they see it the same way. They see it the same exact way as, okay, I'm the doctor, you're the patient, so you do what I say and that's it. And sometimes they put us in a box. No, we can't be put all in the same box because all of us are different, right? We're all different, we're individuals. And you have to let your healthcare provider know and make them aware that, hey, this is a partnership. Okay, you do what you're supposed to do. I'm going to do what I'm supposed to do. Sorry, I keep hitting the mic. I'm going to do what I'm supposed to do. All right, get that. I hope you other patients out there are listening to that. You have to do what you're supposed to do in order for this thing to be successful. This thing is my health. Because why is it important? Because my life depends upon it, right? That's the attitude, the mindset we should have. However, we also need to know this as well, that not all partnerships last in the business, right? For whatever reason. Not that you had a confrontation. Sometimes things may go, we may be growing apart, right? Because now I'm really going this way and you're going that way, or you just might need something fresh to just some freshness, some newness to it all. So, however, as a patient partner, right, you have to inspect what you expect. You should always be inspecting what you expect. And what I mean by that is, okay, every doctor, your PCPs, your primary healthcare providers, you should be doing inspections. And what I mean by that, I'm not saying take your white glove and is this clean? No. Okay, you should be evaluating every visit, every conversation. Why does he or she want to do this? Why do they want to go that route now? Why all of a sudden the big change? And the reason why I said it, because of my experience, I had doctors practicing, because that's what they do. They're practicing medicine. But they wanted to use me as an experiment. Yes, as an experiment. Hey, listen, I don't have time for you to experiment on me, right? We're trying to get well. We're on a good path. My spirit is comfortable with this. Why are we changing it up now? Right? So I'm inspecting that. Why is the change? And so I'm going to ask questions like that. The why. Remember the why. If things are not working out for you as the business owner, remember, it's the business of you. It's the health business of you. If it's not working out, because you're the owner of it, you own it, right? You own it. So if it's not working out, you have the right. And remember, you have patient rights. You have patient rights. Not enough patients know that we have rights. I've seen it in the dialysis center. I've seen it and overheard conversations where people don't think they have the right, and talk to individuals in the lobby. Well, they the doctor, so I'm just wait a minute. Yeah, I get that. I get it. They are the professional. Yes. However, it's a partnership. It's a partnership. And sometimes things don't work out. They just don't work out. And you have the right to say, hey, this is not working out. It's not really what I expected. And, sometimes it's like, me and you, we just not gelling. We don't have to be angry and the neck we don't have to do any of that. We can be professional about it, right? Because they are healthcare professionals, right? It's the business of me, business of you, and we can be very diplomatic about the situation. And you can dissolve that partnership. You have the right to do so. And do your due diligence, search for a new primary care physician, a new doctor, a different specialist, a different office. You have the right to do it. No one is going to hold it against you. Only person, if you don't do it, the only person or entity that's going to hold it against you is your health, your body, your mentality, your mental state, your sanity. Is going to hold it against you, right? So you have to do something about that. Remember, you're the decision maker for you, okay? Pray about it. Listen to your spirit. Listen to your spirit. I had a situation, and I won't get into it today, but I tell it in my docu-series in episode 2, Finding Dr. Kumar. If you haven't seen it, go to the YouTube channel and go look at that and find out what happened to me. And this is why I'm so adamant about saying these things about partnership. Okay? So you can dissolve that partnership and seek out another one you are satisfied with. Okay? All right. So moving on. Prepare your questions in advance. If you get nervous, I know that anticipation and anxiety will set in oftentimes when we have doctor's appointments or going to see this doctor or this specialist about this because they found this, they saw that. We may have a little bit of anxiety and anticipation. Pray about it first. Before you go. We don't fear anything because God hasn't given us a spirit of fear, but of love, power, and soundness of mind. So no fear there, because we're just trying to gather information and we're curious to know what's going on, right? But don't let it get the best of you. I understand, feeling overwhelmed, going to these doctor's appointments because, you just might hear something you don't want to hear, but that's the reality of things. But don't let it cloud your thinking. Don't let it overtake you. So it's best to prepare your questions in advance prior to going. If you know the appointment, if you know what it's about, rather, set aside some time to jot down your questions regarding your concerns, right? Clear your head, clear your mind, get yourself together, right? Have a meeting with yourself because you're the business owner, right? You're the business owner, you're the CEO, you're the COO, the CFO, and everything else that come along with the business. You're that person. So sit down, have a meeting with yourself, gather your thoughts. If there are some concerns, jot them down. And don't do it alone. I know I mentioned all those persons are you. However, ask your spouse if you're married. Ask a parent. Someone a little bit older than you has a little bit more wisdom than you do. Ask someone who may have dealt with the same thing, right? Ask someone else and get their take on it. Ask your sibling or that best friend you trust. Never assume that the doctor will go over these things that may be in your mind. Don't assume that. Always ask that question. And remember, no question is a dumb question, right? Just ask. Just ask the question. You never know. The doctor may be stumped and he or she may say, wow, that's a great question. I never thought of it that way. So let's just hope they have an answer for you. So listen, I want to thank you guys for watching. That's pretty much it. I hope you got something from this. Again, if you guys have any questions for us here at the Kidney Corner podcast, you can email us. You see it at the bottom of the screen. getinposition21@gmail.com. Also subscribe to our YouTube channel here at www.getinposition21.org. We got a lot of great and exciting things coming up. We got our podcast coming up October the 8th, Tuesday, October the 8th, next week, Tuesday, October the 8th. Please share and spread the word in regards to, we will have some exciting guests as it relates to obtaining financial assistance when you're seeking after a kidney transplant. Trust me, as a post-transplant recipient, those financial programs are vital. They are vital to your survival. I'm telling you, because there's a lot you have to deal with, a lot of medications, a lot of traveling, even getting evaluated. There's some programs out there that will assist you with your travel, mileage, gas. They don't cover food, so that's on you. But you can get reimbursed for those items, and we'll have some professionals there. And also we'll have a social worker from the kidney transplant division or department at MUSC right here. Yeah, that's my transplant facility. So she will be joining us. It's going to be very, very exciting. You can interact with us real time, ask questions to these individuals because you want to know how is it available, how you can get started, how you can raise money. One program, actually, you will raise funds for your campaign. And if you're a Georgia resident, if you are a Georgia resident, they will match up to $10,000. You raise $5,000, they'll match $5,000. You raise $8,000, they'll match $8,000, right? Let alone if you raise 10, you got 20. All right. So you definitely want to tune in for that. So I thank you guys for watching. As always, get in position as it relates to your health. We'll see you soon.